Holidays are here, and the smell of the sweet taffy and the peanut brittle, it may remind you of chowing down as you did when you were a kid. But as we get older, we have to watch our dental health, especially around the holidays. Joining us now to tell us more about aging teeth is dental surgeon Dr. Ted Grellner. And Doctor, you have run the full gamut when it comes to you started out as a general dentist, became an oral surgeon, so you know from start to finish what's going on.
I've seen little problems turn into big problems, unfortunately.
Yeah. All right, so obviously, very important as we get older to take better health of our teeth. Tell us what's going on as we get older, the breakdown of our teeth, and why it's more important to do.
Well, when you get older, there are medical issues that start to arise, and medical issues like high blood pressure is out of control, heart attack that may limit your being able to get treated. Even a simple dental procedure might have to be postponed for 6 months while your heart muscle repairs from that heart attack. People who have been on osteoporosis medications for a long time, that can actually prevent them from having any surgery on the jawbone, even a simple extraction, because the bone may not heal afterwards. Pregnancy is a big one.
Yeah, because it's pulling the calcium, correct?
Well,
the baby,
but the thing is that if a woman develops a dental problem while she's pregnant, it limits the antibiotics, it limits the pain medication she can have, limits the anesthetics that she can have, and it makes for a much more unpleasant experience, unfortunately, because of those limitations. So it's very important for a woman to get herself checked well, you know, as far as her dental health before getting pregnant, if that's possible.
Okay, so make sure you maintain it. Now, you brought a display here. Let's talk about these different steps that we're looking at here and how it affects our aging process.
Well, this is the progression of someone with teeth. They've lost their teeth, and from this point to this point represents about 20 to 25 years.
Wow.
So in that short of a time, once you hit this point, you're basically a dental cripple. You can't even wear a denture because you have no bony ridge to be able to support that denture. So the thing that is now available that may slow some of that bone loss are dental implants. They're the only thing, because otherwise when that tooth is taken out, yes, the inside of the socket may heal, but the outside bone surface is already melting away like a snowman. I mean, it's crazy. Yeah. And you can see that when all the teeth are removed.
Right. Yeah.
It used to be that we thought
lower and lower.
Well, there used to be we thought it was the wearing of the dentures that put pressure on the bone, but this happens without anyone even having a denture made.
Really?
Yeah.
Wow. Okay. So obviously, everyone at home wanting to know, what do we do to prevent this from happening?
Well, it starts from the beginning. Sweets are a problem. It's not so much how often you brush, it's how often you've got sweets in your mouth. I'm talking about not artificial sweeteners, but of course processed sugar.
Right.
And the worst form of sweet is the one that's sticky, like the toffee that you mentioned early on. Caramels, those kind of things. So you need to be able to get that sweetness out of your mouth fairly quickly, because the bacteria you miss when you're brushing, you're going to turn that sugar into acid that's going to eat away at the tooth. The more time that sugar's in the mouth, the more it eats away at the tooth until finally it crumbles and turns into a cavity.
Wow.
Okay. Then it just goes, it almost snowballs. A cavity that's left untreated, if it starts to hurt, now that tooth's starting to get infected. And your only choice at that point is a root canal or to have the tooth out.
Right.
Tooth is out, you start losing bone. You know, it's a snowball effect.
Yeah. All right. So we get the cavity. What's the next step? Obviously, we come see the dentist. But what do you recommend after it gets filled? It gets what's the next step after that?
You know, bacteria live on a microscopic level, and even with fillings or with crowns, you can still get recurrent decay around the filling or around the crown. And you really need to starve the bacteria, unfortunately. So that's why I started at the beginning. You really have to watch those sweets.
Okay.
It's impossible to be able to brush your teeth so well that there's no bacteria on your teeth.
Right, absolutely, because it's going to start forming almost immediately.
Right.
Okay.
Well, you've got 24 hours for that bacteria to stick to the teeth.
Okay.
So if you do one thorough job of brushing, you know, once a day, I mean, you're going to be pretty good. And then your next best step is starve the little buggers.
Okay, there you go. So this may be a redundant question here, but if you give us one tip to get through the holidays and make sure that our teeth are in the best condition they can be, what would it be?
I'd say enjoy your sweets, but get them out of your mouth. Rinse with water afterwards to dissolve them quickly.
Okay.
Can I make one other point?
Yeah, absolutely.
You know, the holidays is sort of a stressful period. This is not one of my tools.
I was going to say, wait.
But these pliers simulate our jaw in that we generate a lot of force closer to the joint than further away. So the point is that stress is a habit that brings about clenching and grinding.
Right.
We can actually split our teeth in the back because of the heavy pressures of clenching. So going to your general dentist and getting a heavy plastic custom-made night guard is very helpful for protecting your teeth from those destructive forces.
Okay, so talking about night guards as well, I know my dentist has talked about that because one of my pastimes is grinding my teeth. For more information on this, guys, head over to casa.com. Keep those pearly whites pearly white through the holiday season.